viewers out there. May Almighty Allah keep protecting us and guide us, lead us to the right path. I wish to continue with cardiovascular part 2. The first part of cardiovascular, we talk about high blood pressure. So it's continuation of high blood pressure. That is hypertension. When the pressure that carries blood from the heart to the other part of the body move with very high pressure. It has been recommended by WHO 120/80 is the normal one. If once it's above that, one begins to experience high blood pressure. There are symptoms that when someone begins to feel this, you quickly go and do your checkup. Severe headache, nausea, sometimes one feel like vomiting, blunt vision, you don't see clearly, you feel pains between the chest, like angina, and some people do confuse themselves thinking it's ulcer instead of going for proper checkup to confirm that it's high blood pressure. High blood pressure, if not properly maintained and cared for, can move to other more complicated form of cardiovascular disorder. It can become heart attack, heart failure, because when the blood moves with very high pressure through the ventricles of the heart, it makes it become thickening and enlarge in size, hereby damaging the walls of the ventricle. And this can also lead to heart attack and heart failure, which in further discussion I'm going to discuss more on heart attack and heart failure differently. So high blood pressure needs to be controlled and managed. I told you initially that most health personnel have their own forms of maintaining high blood pressure, while dietitians will have our own method of trying to stabilize the pressure to come back to normal and change people's lifestyle. You see, it can be caused by people that are smoking. People that smoke too much will have their risk of having high blood pressure. Obesity can lead to high blood pressure. Consuming of excess sugary foods and fatty food, taking of carbonated drinks can lead to high blood pressure. Taking of excessive sodium, that is salt, can also lead to high blood pressure. People that take excess alcohol can lead to high blood pressure. Not having enough sleep can lead to high blood pressure. People that don't take enough water, up to at least 8 glasses of water every day, can lead to high blood pressure. If one can avoid all these things, change lifestyle and go the opposite way, then there's tendency that anything high blood pressure will be reduced or will be gone forever, because this is dieting. But what about the food? If we change lifestyle, there are food that we need to introduce into somebody's life and food that we need to cut off. I told you the first type of food is going to be sodium restricted or sodium reduced diet. Normal sodium 2,500 microgram daily will be reduced to maybe 1,500 microgram depending on the severity of the high blood pressure. But if the pressure is too high, up to 150, 170, even 200 over 100, 120, 130 and above, then we put that person on very, very low sodium intake or restricted sodium intake. When we say restricted sodium intake, even the food that we are going to use to produce the foodstuff, the ingredient that we mix together, that we are going to use to produce that food must be checked properly. We say we do advise people with high blood pressure to take a lot of fruits and vegetables, but we go deep and check, especially with the help of our Nigerian food composition table. We'll be able to see even vegetables that have higher sodium will reduce it, like spinach. Spinach have more sodium than pumpkin leaves. So you tell somebody that have a high blood pressure to go more of pumpkin leaves as source of vegetable than spinach. That's why the spinach have more iron than pumpkin leaf, but we are targeting nutrient. In that is there must be certain nutrient that you target and cut it off, or you add it to that food. Then we cut off saturated fats. Fats that are not good, fat that sleep at room temperature, they are hard. So these fats accumulate within the walls of the arteries, leading to blood pumping in a harder way, making it hard pressure, with hard pressure. So we cut off saturated fat and go for unsaturated fat that flow, good fat from, especially from plants. Most of these saturated fat come from animal region, like butter, margarine, or fatty meat. We cut them off. Whole milk from animal origin that has a lot of fat. So we go for skim milk that has no fat. Okay, and then we exchange meat with fish We go for fish. You know, in their 30s, we'll not just say eat fish. There are different types of fish that we target with a lot of omega-3 fatty acids. Fish like tilapia fish, fish like sardine, mackerel, they have enough omega-3 fatty acid that is good for the body. But fish like catfish should be avoided when someone is experiencing any kind of cardiovascular disease, because according to so many researchers, the findings have found out that it has excess omega-6 fatty acid that is not friendly to the heart. So you meet me in my part 3, cardiovascular. We are still on high blood pressure. Thank you very much. I'm Aisha Yusuf, the registered dietitian of Nigeria. Aisha Nutri Diet, my YouTube channel, and don't forget to subscribe, and then you share and like. Thank you very much.